Well, first of all, thank you very much indeed for joining us today. Really appreciate it.
Thank you for having me.
So I know a lot of folks here will know, but for those who don't, tell us a little bit about the work of the foundation.
So my name is Rawle Andrews. I am the executive director. Our mission is very straightforward. We are trying to advance the mental health and well-being of individuals and communities where they live, learn, work, worship, and play.
So tell us a little bit about some of the campaigns you're running.
So our framework is called Notice, Talk, Act, or NTA. And the NTA framework really is all about noticing when somebody's behavior is out of the ordinary or off the spectrum. Once you've noticed somebody in crisis, then the question is, how do we have courageous conversations using bridge words so you know how to talk more effectively to get some information that can be helpful? And then when we get to act under the Notice, Talk, Act framework, really what we're trying to do is make sure that we're not just saying there's a one-stop, one-size-fits-all. There could be a range of things that might help a person or a family in crisis. You got to have that tool belt equipped so you're able to do that.
So we've heard a lot at the conference about the Mental Health Care Works campaign. Now, I know you're heavily involved in that. Tell us a little bit about that campaign.
So the Mental Health Care Works campaign is an umbrella mental health literacy campaign that is designed to change the narrative on awareness, on attitude, and behavior. And so what happens, what we expect to see, is that people are going to learn their mental health conditions are indeed treatable. And we just want to talk about treatability. And then you get to the point in the middle of the campaign where you're saying, now that you know it's treatable, why don't we talk to a medical provider about it? And then once we've done that, we hope we're going to transform like others in diabetes, cancer, HIV and AIDS, where they don't talk about stigma. They talk about no health without mental health.
So we're coming out of COVID now, hopefully out of COVID now. What difference has that made to your work?
So I believe it has hurt and helped at the same time, because the reality of it is everybody has been changed by what we had to deal with for the last 3 years. Nobody's coming out of it the same, and the needs for all of us is different. So whereas before the pandemic, people might not have been comfortable at any stage, at any age, talking about their mental health challenges, now they are. But the numbers are really scary.
Right.
Depression, anxiety, PTSD, eating disorders, off the spectrum. So we've had to redouble our efforts. We're growing our team a little bit. But ultimately, we believe this Mental Health Care Works campaign is going to really help us stem the tide.
Perfect. Thank you ever so much. Really enjoyed talking to you again. Thank you.
Thank you very much.